Welcome to the AMR Independence just-in-time training on Levalbuterol. Because of recent shortages and issues with the manufacturing of albuterol, there has been subsequent shortages, and we've been directly impacted with that. As such, GMR as a company has been able to obtain levalbuterol as a direct substitution for albuterol that we can no longer get. The nice thing about levalbuterol is it is essentially the same in the way it functions and is a direct substitution for albuterol. The main difference in it is they remove one of the isomers out of it, and so you will see that it does require different dosing and concentration. So it's a lot lower concentration and smaller dosing than it is for albuterol. Let's talk a little bit about the pharmacology of levalbuterol. So levalbuterol is very similar to albuterol. Really the biggest difference between it and albuterol is it has a little bit different shape. They took out one of the isomers from albuterol, and in theory it's designed to have a fewer side effects like the fast heartbeat. It is still a moderate selective short-acting beta-2 receptor agonist, so it is a bronchodilator. It has the exact same effect as albuterol, and it's still a positive chronotrope, so you will still see the cardiovascular effects of it, like tachycardia, although it will be a little less than what you would expect to see with albuterol. It also does cause potassium to move across cell membranes inside the cells because of its beta agonist properties, and this lowers the serum potassium concentration, so it can also be used for hyperkalemia cases. Levalbuterol is the generic name. The trade name is Xopenex. This medication has an onset of 10 to 17 minutes, a duration of 5 to 6 hours. The indications are going to be exactly the same as it is with albuterol. So bronchospasm with wheezing, verified by waveform capnography that shows bronchospasm, anaphylaxis with respiratory distress, known or suspected hyperkalemia with EKG changes. Contraindications: known sensitivity to either levalbuterol or albuterol, severe tachycardia, hypertension, severe cardiac disease. Adverse reactions: so you can expect to see tachycardia, palpitations, dysrhythmias, anxiety, tremors, and or dizziness after administering this medication. Levalbuterol, for dosing, we're going to dose it at 1.25 milligrams and 3 milliliters by nebulizer for both adult and pediatric populations. The difference between the two comes in the max dose. For adults, you can repeat that 1.25 milligram and 3 milliliter dose up to 6 times to a max dose of 7.5 milligrams. Pediatrics, you can only repeat it up to 3 times to a max dose of 3.75 milligrams. And this can be done with a duoneb and mixed with ipratropium just as you would with albuterol for 1 dose of duoneb. For hyperkalemia, the treatment is only going to be for adults. It is not indicated in pediatric patients. And it's going to be the same 2.5 milligrams. The difference is it's now going to be in 6 milliliters or 2 bullets. So for hyperkalemia for adults, you're going to give 2.5 milligrams in 6 milliliters by nebulizer. Like I mentioned earlier, it can be mixed with ipratropium, and you can also use it for inline nebulization for patients that are on either CPAP or needing intubation. So we can still do our inline meds just as we would with albuterol. So the medication levalbuterol is pretty simple, not much different than albuterol. So let's talk about the protocols we've updated. So the first protocol we updated was 10.7, which is suspected hyperkalemia. Just like albuterol, we're still going to administer 2.5 milligrams. The only difference is it'll be in 6 milliliters of fluid versus 3 milliliters. So with levalbuterol, you have to put 2 bullets in for 1 dose of levalbuterol for hyperkalemia. The other protocol is 10.13, respiratory distress. There is a bit of a change. From albuterol, the dose is going to be significantly lower. So the dose for levalbuterol is 1.25 milligrams in 3 milliliters. The nice thing is, just like albuterol, you're still going to be putting in a single bullet. So if you do a duoneb, you'll do a single bullet of levalbuterol, and a single bullet of ipratropium bromide. The other thing we did change is we added this to the formulary. So the formulary for 2023 has also been updated. So this is in the new formulary. I encourage you guys all to take a look at it. If you have any questions on this medication or the changes, please feel free to reach out to any of the quick response paramedics, the supervisors, or any of us on the clinical education team. And thank you for watching.